Hi, this is Dr. A with your Intro to the U.S. Healthcare System lesson. We're looking at the current operations of the U.S. healthcare system, and we're going to look at some comparison with healthcare statistics with international data. So, the international healthcare statistics are really helpful because it can help us to see how the U.S. system is doing in comparison to other developed countries. So we use the OECD. So it was established in 1961. It's called the Organization for Economic Cooperation and Development. And it monitors the trends of economic development all over the world in many different industries, including healthcare, right? So currently there are 38 countries that are members of the OECD, including the United States, and there are 6 partner countries. And these countries then report their data to the OECD, and they crunch the data and assemble it and put out some pretty neat graphics that can help visualize this data, and we're going to look at some of them. So, for example, the percent of the GDP that is spent on healthcare. And so we say the U.S. is the most expensive system in the world, and this shows it right here. So these are the 2019-2020 numbers, and so the U.S. Percent of GDP spent is 16.8, and then the next highest is Germany at 11.7. So we're still like a whole 5% of the GDP spent higher than the highest of the other OECD countries. A lot of them are around like 11 so around 11 here to 10.5 to 10. The average of the 38 OECD countries is 8.8. So we are, again, double the average. And it's just interesting to see, for example, our neighbors in Canada are able to provide universal health care for 10.8% of the GDP spent. So it's a good way to track and see where we're at, where everybody else is, and where there might be some problems. So healthcare coverage, so how much of the population has healthcare coverage, and then which one is what part is public and which part is primary private health coverage, meaning usually must be purchased by the individuals. And so you can see the bulk of these OECD countries have 100%, and some of them even 99 or 98%, 99% of their countries, their citizen, or their population. Really, it's better to say population, because part of maybe the percentages that aren't covered are maybe some illegal aliens that are in the country, right? And so you can see here Germany, there's a split a little bit, mostly public but with some private coverage. Switzerland, their whole system is privately funded, but they have 100% coverage. And same thing for the Netherlands. And for us, we're kind of a split. I like to say about 2/3, 1/3, although that's not, it's more of a 60-40 ish split, where the bulk of it is by private health insurance coverage, and then the other is from the governments. So satisfaction for the availability of care. And so we can see the ones that are the most satisfied with their systems are the populations, people who live in Norway, Belgium, the Netherlands, Switzerland. These are all above 90%, so it's really, really high. And then we have the United States. For not having universal healthcare coverage, we still have an impressive 83%. So we are higher than the OECD here on satisfaction with the care that is received. Some of the people that do, populations that do have universal coverage, such as government provided, like Canada and the UK, some of the satisfaction is lower. Some of that has to do with sometimes some inefficiencies and some wait times within those systems. So these dashboards on health are pretty cool to look at. We're not going to look at absolutely all the countries. We'll just highlight a few. But It's a table, and it has the years of life at birth. So the average for the OECD is 81. So if you're born in an OECD country, you can be expected to live to be around 81 years old on average. Another thing that's fun to look at, for example, is the diabetes prevalence in percent of adults. So the OECD average is 6.7%, and the population percentage that is in poor health, and theirs average is 8.5%. So if we look at another large country like Australia, their life expectancy is higher than OECD average. Their diabetes is a little bit lower than the OECD, and their populations in poor health is much lower than the OECD. So they've done really well that way. If we look at our neighbors up north in Canada, their life expectancy is higher than ours at 82. I'm sorry, it's higher than OECD at 82. I believe it's also higher than ours. Their percent of population with diabetes is 7.6. It's slightly higher than OECD, but not bad at all. And population in poor health is only 2.8. So this should actually be in green. So that is really good. And so you can see some of this other data, but let's go see what the U.S. is. So for the U.S., years of life at birth is 78.9. So our life expectancy is a little bit, close to OECD, but below. We can see here that Switzerland and Spain have really high life expectancy rates. And for the United States, we can see, however, though, our diabetes prevalence is quite high at 10.8%. In the UK, for example, it's only 3.9%. And so our population in poor health is only 3.3%, though, and so that's really good. And then we can look and see these other metrics over here. So this is just kind of neat to see how different things compare. Infant mortality rates. So for the U.S., we're pretty good. We're over here slightly above 5, but you have to also dig in a little bit more. In the United States, there's a disproportionate amount between black and white infant mortality, and we addressed that in a previous lesson, briefly just mentioning it. So some of the ones with the highest infant mortality are India, South Africa, and even Mexico. But of course, there are countries like Japan and Finland, Sweden, Norway also do excellent. Here, their infant mortality are really, really, really low. And if we look even to the UK and Canada, also in Australia, also do better than the United States, even though our rates are pretty good. So looking on the dashboard on health risk factors, so those are things that can make a population more sick. So if we look, for example, at Australia, their smoking is 11.2% of the population. OECD average is 16. Alcohol consumption is, for OECD average is 8.7 liters per capita. This is per person. For the liters per capita, this is percent of the population. Sorry about that. Did not mean to go back. And the amount that are overweight or obese. So this is the percent of the population with a BMI above 25. So for OECD countries, above half of the population, so 56.4 is the average. In Australia, it is higher than that, 65.2. And Canada has lower smoking rate at 10.3 than the OECD average. Drinking is about the same, so 8 liters per capita, and BMIs stand about 59%. 59.8 is almost 60% of the population has a BMI above 25. If you look here in the U.S., though, we have 73% of our population with a BMI above 25. So that is a huge amount. But our smoking is really good. So it's only 10.9% of the population, which is really good. And our alcohol, we're right there on average with the OECD with 8.9 liters per capita. We're going to look briefly at pandemic data. So the mental health impact of the COVID-19 pandemic. In 2020, survey of Italian healthcare workers who worked directly with patients, nearly 50% of those surveyed exhibited symptoms of PTSD, with 25% reporting depression. Now, Italy was very severely hit with the COVID-19 pandemic. In the United States, 62% of frontline health workers reported that stress and worry impacted their mental health and their physical health. So that's a big percentage. The prevalence of anxiety and depression in early 2020 was double from previous year in several countries, including the United States, United Kingdom, and France. Where there was a peak in the disease levels, the levels of anxiety and depression also increased. 2020 U.S. survey indicated that people of higher socioeconomic status reported higher levels of dissatisfaction and increases in depression than those of lower socioeconomic status. So we're like, well, why would that be? Why would that make a difference? And they suspect this could be because the higher socioeconomic status people means that you have more disposable income, so more money to go do things. But then during the pandemic, we couldn't do any of it, right? And so not allowed to use your disposable income to travel, to go on vacation, to go to the movies, and go do shopping and things. And so they were more depressed because of not being able to do the things that we used to do, right? So a positive impact of the pandemic was the increased use of telehealth services and, increasing the use of that and increasing the amount of services that were available through telehealth. Across 22 OECD countries, 45% of adults received a medical consultation by telephone or online. But a negative use of the use of telehealth is a reluctance of older patients to use this type of service, and therefore they may have missed out on getting some of the services that they needed. So in conclusion for Chapter 2, data are important because it provide an opportunity to compare health behavior and different results of the statistics to other countries, or also across time to see within a country to see how things are progressing. It is important to compare the United States with other countries, so we have a big overview comparison of world health, and we can see kind of where everybody else and where we ought to be, because if anything, we ought to be with the average, maybe better, but if we could at least be average on some things, that would be really good. So we are the most expensive healthcare system in the world. Should we not be the healthiest? Unfortunately, we are not. And so this wraps up your Chapter 2 on Intro U.S. Healthcare.